The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
A September COVID-19 second wave is exactly what everyone hoped to avoid. And yet, as Premier Doug Ford put it over the weekend, the alarm bells are ringing. Tonight, what's behind the resurgence and how to stop it? Then, would that and winter mean an existential crisis for Ontario's restaurant sector? We'll examine that too. It's Monday, September 21st, and that's ahead on the agenda. There is no way to sugarcoat the rise of COVID-19 case numbers. Over the past few weeks, the curve has gone from flat or declining to one with a steep rise. With us now on where the cases are coming from and what to do about it, we welcome in Guelph, Ontario, Dr. Nicola Mercer, Medical Officer of Health for Wellington Dufferin Guelph Public Health. In North Toronto, Dr. Lawrence Lowe, Medical Officer of Health for the region of Peel. And in Toronto's Harbour Village, Colin Furness, infection control epidemiologist and an assistant professor at the Faculty of Information at the University of Toronto, also cross-appointed to the School of Public Health. And it's great to have you three on TVO tonight. Dr. Furness, welcome back. You've been on before, but first time, I think, for Drs. Mercer and Lowe, so nice to have you aboard. And Dr. Mercer, let me put you to work right away. On Friday, we saw 400 new cases in Ontario. That's the first time since early June that we had seen a number that high. And we have had several days in a row before that of 300 plus cases, which again, we're not accustomed to. We've been seeing better numbers than that recently. Where are these new cases, to the best of your knowledge, coming from?
Yeah, thank you. That's a great question. So locally, which I think we are very similar to other jurisdictions, what you'll see is that it's young adults. So they have currently in our area twice the rate, those between 20 and 39, of any other age group. And actually within that, we also see that it's about predominantly being driven by males. So we're a university town in Guelph, and I'm sure that other university towns are also seeing this, but young adults are predominantly the newest cases that we're seeing.
Dr. Lowe, what would you add to that?
You know, I would agree. It is young adults, and certainly in our region, we're also seeing 60% of our cases, people aged between 20 and 49. In general, what we find in our region is that these are not only the social gatherings, which certainly have been made highlighted in a lot of the recent communications, but it's a bit of a cycle between what we're seeing in workplace outbreaks, and then these individuals then bring it home with them, and then out and about when they're socializing, and then back into the workplace. So it's this general cycle that we keep seeing between these three settings, where we're really focusing all of our efforts at the surge at this time.
Dr. Furness, take us back to an earlier time when we were doing better and we were seeing for a time, you know, about 100 cases a day. What were we doing so well back then that apparently we're not doing as well today to keep the numbers low back then?
The number one thing I land on is actually weather. We can get away with a lot when the weather is hot and it's humid. Those are very protective. That's starting to disappear. So that's number one. But I think number two is toward the end of the summer, a lot of folks throwing up their hands and feeling frustrated and feeling lonely and looking at the low case numbers and saying, I'm going to hug my friends. I'm going to have the party. I'm going to do that because it's been too long. And that's understandable, although, of course, it comes with the consequence that we're seeing.
So fair to say it was inevitable as the weather got colder that even if we just kept doing the same stuff, it was going to get worse.
Of course, the weather hasn't really gotten colder yet, just a little bit. But every drop in temperature, we could expect, according to some models, a 3% increase in cases. So as the temperature continues to drop, my concern is obviously we're going to see more and more.
Dr. Lowe, do you know, is this the so-called second wave everybody has been anticipating?
You know, I think it's really challenging, and I can only really speak to the numbers we're seeing in Peel. But it also is important to know where the cases are. And in Peel, fortunately, at the end of our investigations and our contact tracing, we're figuring out about 80 to 85% of these cases, they have a known exposure. So it's a little different than a second wave where we would see widespread propagated community transmission. At this time, most of the new cases, even though the numbers are high in Peel, are people that are connected to known exposures in workplaces, social gatherings, and in homes as well.
Well, let me put this in a bit of an odd way for you, Dr. Mercer. Are you glad you're not the medical officer of health in Peel or Toronto right now, where the biggest outbreaks seem to be?
Well, I would agree, although Dufferin County is right beside the region of Peel. So we are seeing, and in fact, this past weekend, that's where most of our cases were being driven. And of course, because we are colleagues, we are also supporting the region of Peel with their cases.
Very glad to hear that. Dr. Furness, what about you on this issue of whether we're seeing a second wave yet right now?
We only ever know in hindsight when we look back and see when the wave began. I don't think we're quite there yet. I think Dr. Lowe nailed it. We know what the pattern is there. It doesn't look like it's accelerating in the community to the extent that I might use the word second wave. Remember, in June and into July, we had 400 cases a day or so, and it stayed pretty stable. It was frustrating at that level, but it showed us that that can happen, and that may be what's happening now. My concern is when the temperature really drops. So I think we're not seeing the spike that, to me, that says second wave yet.
Nicola Mercer, let's go over what we now know compared to what we knew in the spring when this thing first hit. What do you know about how the virus works today versus 6 months ago?
Yeah, thank you for the question. I think what we didn't realize early on, we thought of it more of as a respiratory virus only. And what we are learning is that this is really actually a multi-organ virus, which is why when we see people in a hospital, we're seeing a little bit of a different trend. We also know that when people recover from this virus, different from perhaps other coronaviruses that we've seen, is that some of them actually have a very long period of recovery with prolonged symptoms afterwards. So this was something that we actually didn't know about this virus. And I would say the other thing that we're learning is that this is really about human-human interaction and less about fomites, or what by that we mean what we touch. So it's less about the things that were around and more around the people that were around.
So all of that time we spent washing off our mail and being careful not to touch countertops and that was probably exaggerated. Is that what I'm hearing?
Well, those are important things to do for a lot of reasons about keeping your hands clean. But what really is important, it's those human-to-human interactions and less about the paper that we touch and the things that we touch. So those are still important, and I'm not saying that you can't get COVID from those things, but really people are getting COVID from each other.
Lawrence Lowe, what do you know today you didn't know 6 months ago?
Well, I think, certainly echoing what Dr. Mercer has identified, it is people-to-people contact and transmission. And we've known that, in general. But in terms of the circumstances in which that transmission occurs, we have a lot more clarity. We do know, for example, that this virus tends to spread in crowded, poorly ventilated spaces. We know that this virus tends to spread pre-symptomatically with individuals, which is why there's such a critical importance with making sure that there is distancing that is maintained, with making sure that there is limiting numbers, with making sure that there is the use of non-medical masks to prevent transmission in the event that someone is brewing a COVID-19 infection. And all of this was, came to light, at least in the spring, but I think we're even more certain of it now, especially after having seen some very high-profile transmission events that occurred in crowded indoor settings where these precautions were not being taken.
You wouldn't be referring to a certain Make America Great Again rally in Tulsa, Oklahoma or something like that, would you?
It wouldn't be that specific occurrence, of course, but we've seen all kinds of rallies and all kinds of instances, both in the workplaces as well as social gatherings, where once you get a lot of people together, and there's a lot of trust when you see people, obviously, especially when you see them in 3 dimensions instead of on a screen. And the tendency is when people start to let their guard down and they're in these large groups, that's where the virus finds a way to go from person to person, and especially so if it's indoors and in a poorly ventilated space.
Colin Furness, what are you wiser about today than you were 6 months ago?
My colleagues have not left me a lot of wiggle room left. I think masks work so much better than I think anyone ever thought. And that's remarkable because we're not even paying attention to what kind of fabric we're using. A mask that slows down droplets, that constrains droplets, seems to be incredibly effective. That's number one. The other thing I would add is that COVID is not an equal opportunity virus. We said it was at the very beginning. It actually hits marginalized populations higher. It hits long-term care homes. It hits low safety factory settings. It hits poverty-ridden neighborhoods where there's overcrowding, where you have essential workers who do not have the opportunity to work at home, and so on and so forth. So we see inequity laid bare. And I think this is one of the big things that we can do when COVID finally subsides, is really start to address some of that inequity.
Yeah, maybe I could get you to follow up with this, Dr. Furness, because now I can say this because I used to be one, but I'm not sure there's anything dumber in the world than a young man who thinks he can't get sick. And right now we apparently in this province and across the continent have a lot of young men who think, well, if I get COVID-19, you know, it'll be like I have the flu for a few days, but then I'll be back at it. What kind of message do you think can penetrate the skull of a person who thinks they're invulnerable?
That is the $64,000 question. I think back to when I was in my 20s. I think I might not be nearly as well behaved as I'd like to think I would be. It's awful for people in their 20s, and males do actually tend to have worse health behavior habits than females, especially in that age group. It's very difficult. Health behavior change can work on fear, but trying to get people to live in fear is not where we want to be. Other kinds of health interventions for other things like wearing condoms or wearing seatbelts. They're difficult. It takes a generation of drumming in that message. You can get people to brush their teeth by telling them that their breath will smell bad, and that works for smoking too. So maybe finding that one thing that is socially relevant, saying you don't want your peers to blame you for X. Maybe that's it. But there's no easy answer there. It's a very tough problem.
Yeah, Nicola Mercer, you're not far away from the University of Guelph right now, where let's face it, if it's a typical university, there may be people who are having large parties, not physically distancing, to be sure. What message gets through to that crowd when that crowd pretty much thinks they're invulnerable?
Yeah, we've been really thinking a lot about this and trying to look at perhaps using social media influencers to try and get the message across. I think for the university crowd, which it may be a little bit different than some other young adult crowds, the possibility of having to be in self-isolation for 14 days, that's actually a pretty big deterrent. This is not the age group that wants to stay home for 14 days. They don't want to stay home for 4 hours, never mind 14 days. And just like you've said, it is our young males that are really driving this. So we are looking and thinking and trying to work with our university. We're very connected with the University of Guelph, our health unit and health services there. So trying to find those triggers. And I honestly have to say that after they've gone to a social gathering, we do see that they come and get testing. What we're trying to say to them, though, is before you go to the social gathering, think rather than afterwards.
Lawrence Lowe, you know that well, in Peel Region, you've had a bit of a problem with big house parties, and both the Premier and the Mayor of Brampton, for example, Patrick Brown, have come out publicly and said, come on, Pete. Well, what was the expression the Premier used the other day? A few fries short of a Happy Meal? How do you get your message through? I know you do a briefing every week, a televised briefing. How do you get the message through to this 20-something crowd that they can make things miserable for everybody?
Well, Steve, I first of all should disclose that I'm a proud alumnus of Western University, and so I know a little thing or two about social events. But I think the story of Peel is actually a bit more broad and complex than that, and it really goes to what Dr. Furness was saying earlier as well in respect of inequities. I think the story of what we're seeing in Peel is certainly young people are having these big backyard parties and those social gatherings, but that's only part of the triad that I was talking about. And in general, the workplace is a significant challenge for us in Peel. Again, we have many industries, many places of work where people don't have the option of working remotely, and where if employers are not taking precautions, this is going to create crowded environments that the virus loves to spread in. So I think what we're seeing in the numbers, and especially through our contact tracing, what we've actually seen in data, borne out in data, is that certainly social gatherings are one part of it, but this is also the age group that is more precariously employed and certainly more challenged if employers employers aren't taking precautions to keep them safe.
Well, let me look to another area then with you, Dr. Lowe, in doing a follow-up here. How about restaurants in Peel? Do you have any sense about whether or not people are contracting COVID-19 by eating indoors in restaurants?
Well, Steve, this is the funny thing. It's like if we were seeing public exposures and if we were identifying, significant transmission in restaurant and bar settings, I would absolutely be out there. I'd be, saying there's a risk to the public. We've identified this time. Contact tracing's been, started, etc. We do see transmission in those settings, but it tends to be between staff. And a lot of the times, it's important to actually remember that when you're done the workday or when you're on a break, that doesn't mean that you take a break from the precautions too. And what we've seen in a lot of these workplace outbreaks are people, they might be out on the company floor, they might be out in front of customers for 8, 10, 12 hours. And then afterwards, they're with their friends, their team, they let their guard down, they sit around and have a couple drinks in the back room, and that's where the transmission occurs. So it's crucial for employers to take steps to protect their employees, and it's also crucial for employees to remember that distancing, masking, all that stuff needs to happen whether you're in front of the public or whether you're resting in the back room.
Colin Furness, how about going to the gym, going to the health club? A lot of people want to get back to doing that right now. Dr. Furness, what's your advice on that?
From a mental health perspective and a general health perspective, obviously exercise is great, and that's not something I would want to talk people out of. However, if the gym involved is going to have low ventilation, if people are exercising and working without masks, if the locker room and showers are in use and there are not masks, then I'm very concerned. Some gyms blow air around the room to air people out, but that's not the same thing as ventilation. In fact, that can blow droplets from one person to another. So gyms feel like an unsafe environment to me for the most part. There could be some that are doing it well, but I would be extremely cautious and maybe perhaps find other ways to exercise to replace that.
And Nicola Mercer, let me ask you a similar question in as much as not too long from now, I think a lot of the indoor hockey arenas are going to be opening up. Those rec leagues, those rec hockey leagues are going to be getting back in business, or indoor soccer leagues, that kind of thing. What's your advice about whether or not people should participate in that?
Yeah, and another interesting question. Well, when you look at those indoor spaces, tennis, hockey, soccer, really that minimal close contact in a very large area, that's actually probably quite safe to do. Where you really have to be concerned about, though, is the locker room. So again, it's all about getting close and in a confined space for a prolonged period of time with others. So, if you can strap on your skates in a very big area and get on the ice, you're not really having that constant prolonged contact up close and personal with your colleagues where you're playing. So there is lots of indoor activities that you can do. Perhaps wrestling might not be the best sport because, again, that would meet all those criteria, but others you can do safely.
So just to be clear, maybe get your hockey equipment on at home, go play, and then shower and change back at home again as opposed to in the locker room at the arena? Is that the idea?
Yeah, we want to minimize the number of people you put in a confined space for a prolonged period of time. So you're right. If you can put your stuff safely on somewhere else and then enter the hockey arena, then you're not having that interpersonal contact. Remember, this is things don't give it to you. It's people that give it to you as you're talking to them.
Now, Dr. Furness, I take your admonition to heart about gymnasiums or health clubs. But do we know, do the statistics indicate that people are actually contracting COVID-19 while working out at health clubs?
I don't think health clubs come to the top of the list so far, although I'm not that close to the data. But we have to remember that with maybe 20-25% of cases, maybe higher, being fully asymptomatic, the contact tracing isn't going to necessarily tell us that. We don't know about contacts on public transit, in restaurants, in gyms, partly because I think it can be very hard to find that chain of transmission when you have asymptomatic folks. So someone may not experience illness, but then eventually passes it along. So these are risky areas. It's more based on understanding the risk than actually being able to see it in the data.
Let me get the three of you to weigh in on this. And I've had tons of emails and phone calls from people, as I'm sure you have, who are trying to get their heads around the consistency of policy, consistency of approach. We know, for example, that the province, last week, I guess, put in much heftier fines for social gatherings. They want to keep those numbers down again, 10 people indoors, 25 people outdoors, with notable exceptions. The workplace, the classroom, where it seems to be okay to jam 30 people into a small space where otherwise you'd only have 10. you know, maybe we're nuts to look for consistency in this kind of thing, but let's try it anyway. Dr. Furness, does it make sense to exempt places like classrooms or workplaces from the kinds of protocols that seem to be important everywhere else?
The reality is that every classroom and every office is going to have different characteristics around ventilation, and trying to find a one-size-fits-all rule is going to be difficult. Either you're going to make it onerous on everyone, or you're going to make it dangerous in some cases. It feels to me like the province is tilted more toward making it dangerous in some cases. They could have, for example, committed to a minimum number of teachers that might have resulted in some classes being strangely small, but they haven't. So instead, some classes are strangely big, and that's a bad idea. But it's awfully hard to say this is exactly the right rule and it's going to work in all of these contexts. So it's a challenge.
Dr. Mercer, your view?
Well, I think if you look at businesses, for example, there's a lot of control that is in the hands of the employer from a health and safety perspective. So when we see outbreaks in our workplaces, traditionally it's actually in areas where they haven't put in all those public health control measures that they could. So, and also they're a cohort. So people tend to work together. You don't have people coming and going. We're not seeing the transmission between customer and staff. We're seeing it really amongst staff. So with our workplaces, I believe that we can safely reopen. They just need to put into play very strict public health measures that in particular, when the staff are working and talking to each other in the break rooms and during lunch, that's an important key. When it comes to schools, I think this is really a balance. This is a very challenging question, because what we have is we have a whole generation of kids that need their education, not just for their future learning, but it's also for their mental health. So this is really a challenge. Children need to be in school. They need an opportunity to learn on many levels. And trying to do that safely is what we're trying to do. And I think the real advantage that we have with schools is that they are a cohort. So it's not that we're having them blended with many people. We actually have them with a specific number of people that we can do case and contact management with if needed.
Okay, Lawrence Lowe, given the context that Dr. Mercer then just put around that issue, is the policy less inconsistent then than at first blush it might seem to be?
Absolutely. I think it's a policy that is targeted at a specific setting with a recognition, as Dr. Furness and Dr. Mercer have both said, that different settings are going to need different precautions and measures. And the reason why this has been brought in for social gatherings is if you think about your usual social gatherings, they tend to be not monitored. They tend to not be cohorts. They often can occur spontaneously, in fact, and that makes things very difficult in the event there's an exposure and in the event that transmission occurs. Whereas as my colleagues have already identified, cohorting, precautions, the supervision of those are things that do make things differently in those other settings. That said, it's important still, as much as possible, to remember that in limiting disease transmission from person to person, the best way to do it is by limiting proximity, duration, and numbers. So if you can't limit it on one, you've got to figure out some other way to limit it on the other pieces.
And let me do a fast follow-up with you, Dr. Lowe. Have I got this right? In your region, there have been some COVID outbreaks from weddings. Were these indoors or outdoor weddings?
So I'd have to go back and double check that, whether it's our region or other regions in the Greater Toronto area. But there have definitely been exposures and cases that that have been associated with weddings. And as I understand it, these were weddings that were both indoors and outdoors. Even prior to the social gathering limits coming into place, people were actually combining accumulatively the 100 and the 50, so that they would have a 150-person wedding, which, as you know, would present significant infractions and challenges. But yes, weddings definitely have been seen as a vehicle of transmission, and certainly is something that I would encourage everyone, again, limiting proximity, duration, and numbers, to possibly rethink if they're thinking of getting married in the fall.
Dr. Furness, is it time to ban indoor weddings with 150 people?
Weddings are the perfect storm. They're indoors, they're big, they're multi-generational, and you can plan for masks and physical distancing, but weddings are about affection and love and closeness. And once a little bit of alcohol flows, I don't think you've got any hope of having a safe party. My advice to anyone is don't delay getting married, but maybe have the party in a year from now. So maybe separate that. Maybe have the biggest first anniversary anyone's ever seen, as opposed to the dangerous wedding party now.
That feels like very sensible advice. Okay, we're down to our last few minutes here, and I don't know what your interactions with members of the public have been, but mine suggest that people are taking this, how do I put this, less seriously, I think is really the way to put it right now. We may feel that we have learned to live with COVID. We may feel more comfortable getting together with people now. We figure we've made it this far, 6 months without getting it. And therefore there is a sense, not just obviously among the youth, but with older people as well, that maybe we can let our guard down a little bit. And I guess I want to know from all of you, Dr. Mercer, why don't you start? Should we be as fearful of this thing today as we were 6 months ago?
Yeah, I personally think we should. It is spreading in our communities, as and my colleagues have said. We're probably not quite in our second wave yet because we know where all the cases are. But it wouldn't take very much, especially with our young adult community and with pre-symptomatic and asymptomatic transmission, for this to really get very big, the numbers. It could easily double or triple in a very short period of time. And although many in our population are going to be just fine if they get it, if it gets into the older population or those with underlying medical conditions, those who are pregnant, these people seem to have poor outcomes, and they could quickly overwhelm our healthcare system. And it is in your control. You can actually do something to prevent yourself from getting COVID. You can wear a mask, physically distance yourself from others, and limit your interactions in those crowded, close quarters where there are a lot of other people that aren't in your immediate bubble. You have control over this one.
Dr. Lowe, do we have to fear COVID today as much as we did 6 months ago?
Steve, it's interesting that you mentioned that you're seeing it in the public. Our data have shown this as well. Our contact tracers used to, in initiating on exposures, most people had an average of 3 to 5 contacts. Nowadays, they have an average of about 20 to 30 contacts. So clearly, there are a lot of people out there that are even going beyond their social bubbles. And that's concerning because I think we do need to be, serious about this disease. We do know the younger demographics getting it, but they're not seeing necessarily the same healthcare outcomes, but it can be spread on to people that are vulnerable in the short term, as Dr. Mercer's identified. And then certainly more concerning in the longer term is this is still a new disease for which we've only known for the last 9 months, and we're starting to see evidence of long-term complications in certain individuals, trying to understand that. Honestly, the best way to avoid all of that and to keep everyone safe is to make sure that we're just sticking to the precautions, and we can live with it, just making sure that we're living in the adapted manner that reduces proximity, duration, and numbers.
Understood. It's really good of all three of you to join us on TVO tonight and share your expertise with us. Colin Furness, Lawrence Lowe, Nicola Mercer. Be safe, be well out there, everybody. As my dad always likes to say, stay positive, but test negative.
Thanks.
Thank you.
Good. Thank you very much.
When emergency legislation shuttered businesses across the province, restaurants and the people who run them and work in them were among the hardest hit. And while retail and other businesses began to return, food service still faces serious limitations. Now, with cases spiking and the end of patio season approaching, what are their prospects for survival? Let's ask. In St. Catharines, Ontario, Tamara Jensen. She is co-owner of the restaurant Dispatch. And in Leslieville, in Toronto's East End, John Sinopoli, executive chef and owner of the Ascari Hospitality Group. And we are delighted to welcome you to TVO tonight. John, good to see you again. You were on a few months ago. And I just want to set up our discussion here tonight, throw a few facts at you folks who know them all too well, and our viewers and listeners to get everybody up to scratch here. So Sheldon, if you would, let's bring up this graphic. Will restaurants survive this pandemic? Here we go. 1 out of every 5 jobs lost due to the pandemic was in food service. 1 out of every 5 lost jobs. In Ontario, there are still 100,000 jobs that existed in February that have not come back. An estimated 10% of food service businesses across Canada have already permanently closed due to the impacts of the pandemic, and most are still losing money and expect the fall months to be much worse than the summers. Okay, John, as I indicated, you were on just a few months ago telling us about how you were pulling out all the stops in order to try to innovate to keep your businesses going and your people employed. Bring us up to date from when you were on back then. How are things going now?
Well, now is the most critical time, as we've, really done our best to keep engaged with our clients and our customers through patio service and through online events and online retail and in-store retail as well. But as the colder weather approaches and people's appetite for coming indoors is still mitigated by the pandemic, we're now at risk of a complete catastrophe in the industry.
How do you define complete catastrophe?
Well, we've already lost 10 to 25% of the restaurants shuttered for good. One could argue that the strongest have survived through this so far, but it doesn't matter how strong you are. At 50% of your capacity, you cannot pay your bills in our industry. Our margins don't allow for that. We need aid from the federal government that is long lasting, and changes in policy to liquor laws from the provincial government that are permanent, so that we can have a business model that allows us to survive. So, we're talking about 50 to 60% failure rate in the next 2 months as patios close. That's a catastrophe.
Tamara, I know some people in Toronto like to think of themselves as the center of the universe, but you and I both know there's a lot of Ontario outside Toronto, and you're part of that, and that's why we wanted to have you on the program. So you're in St. Catharines in the Niagara Peninsula, and let's just start with this. Who are your customers under normal circumstances?
So normally our customers are driven quite a bit by tourism. So we were very much a destination restaurant. We were only a year old when everything shut down in March. But in that year, we got some recognition nationally that brought in a lot of guests from upstate New York and all over Ontario, different provinces. So we weren't really a neighborhood restaurant. We relied a lot on tourism, which many businesses in Niagara do.
All right, so the border's closed now. What has that done to your business if a good chunk of your customers used to come from upstate New York?
Well, what we're seeing in Niagara is the folks that are going out and frequenting restaurants tend to be on the younger side. They tend to be more of, the patio drinking crowd. As a fine dining restaurant, that hasn't typically been our clientele. So we have tried to pivot to a more casual model. We have our patio service going. We're focusing on some really unique wines and cocktails. We've completely changed our menu to be, smaller plates and just a little more casual than what we were pre-COVID. So we've had to shift basically our model and put the effort into attracting a whole different clientele now.
But do I assume that all those people who might have come in from Buffalo or Lackawanna or Seneca, they're not coming anymore, I guess?
Yes, absolutely. And not for the foreseeable future, obviously.
Now, one does notice when one walks around the downtown of Toronto and other places as well, that, the patios have really been extended right out into the street. They have taken out lanes of traffic. The patios are expanded and, very often you see them quite full here in the capital city. What's your experience with that in the Niagara Peninsula?
So we're in downtown St. Catharines, so we are in more of the more populated area of Niagara, but we're not quite in the entertainment hub of our city. We're a little bit down the street in an arts district. So our city has created a road closure that really supports the restaurants. They're out on the streets with their patios. We've built a patio on the street in front of our restaurant. We're fortunate to have that space. But we're actually, in a sense, competing now with the city's marketing dollars to attract local customers to our restaurant down the street. So it's been a bit tricky in our case, but we have a very supportive community. We collaborate a lot with arts organizations, nonprofits, and just other businesses at our end of the street.
John, what's your experience at your places with expanded patio service?
Yeah, it was good and it was expensive. So we were able to build a patio where patios didn't exist before at one of our restaurants. We were able to expand existing patios at the other two locations, given the new regulations by the city, as well as with very amenable and agreeable landlords. So that was very helpful. But it costs a lot of money. That construction is a lot of money. The umbrellas, the heaters, the chairs, all those things cost thousands of dollars we wouldn't normally have to spend, all to just kind of build up to 50-60% of our normal sales. So we're really spending a lot for very little and basically keeping alive due to the wage subsidy and other government programs that have existed up to now. But as we move forward into the fall and those programs have their horizon very, very in the near future, it's not looking good. So we need governments now to understand there is going to be the most crucial part of crucial time for the industry, and we need them to create programs to reflect the length of recovery necessary as well as the scope of support that's needed.
Well, you've got two obvious things about to happen, I gather. You've got these government programs that are going to come to an end or be phased out, replaced by something potentially, but we'll see. And then, of course, it's going to get cold. So what's that going to do to your patio business?
Yeah, well, patio business is already on the decline. Every night that gets cooler, we see the patio business ending earlier in the evening, with some people feeling comfortable to come inside and some people not. You know, we have very, very stringent best-in-class protocols and cleaning protocols for inside our restaurant. So we do our best to make our customers and our clients feel safe, as do many thousands of restaurants across the province. But there are people who are not comfortable coming inside yet, and that's understandable. And so our business is literally taking a 20 to 30% drop every time we have a cool night.
Tamara, are you able to get heaters that are big enough in order to encourage people to continue to come to your patios?
We aren't. We're seeing actually, you know, in different industry groups, people messaging, where can I find a patio heater? They're sold out everywhere. We're seeing Toronto restaurants, you know, come down and shop at the Canadian Tire in Welland to try to find one patio heater. It's been very difficult. You know, as a group, we've decided it's probably not even worth the investment for the next few weeks to try to extend that patio season. And so we're just going back and forth about if and when we feel comfortable reopening for indoor service. What we're hearing from our clientele is that they're not ready, which makes me very nervous. But we will see as things cool down. And obviously, we do have all of the safety protocols in place. Hopefully, we can still generate some revenue of some sort.
Well, John, let me put that to you, because actually, if I read the weather forecast properly, we're supposed to get pretty spectacular weather given the time of year we're in over the next week or so. How does that figure in your...
Yeah, it figures strongly. So, we're making the same kind of calculations as Tamara and her group were, and you know, her weather might be slightly different in St. Catharines, but for us, because we're close to buildings in downtown, we made the calculation that investing in patio heaters was definitely the way to go for us, especially given that all of our competition around us is doing the same. The warm weather coming ahead for the next week is a godsend. We're very grateful for it, but we know that that's a finite kind of situation, and it's basically a mirage that is slowly disappearing, and we need those who control public policy to make sure that we are in a position as good operators, as contributors to GDP, as employers of many, many vulnerable people, that we are able to survive the winter and keep our employees attached to our business. Otherwise, we have no way to relaunch. So, you know, provincially, that takes a different form. Provincially, that takes the form of, you know, good rent policy, which means a ban on commercial evictions through the winter. It also takes a form of allowing us to improve our margins by changing the liquor laws and regulations. So, you know, Ontario is the only jurisdiction, maybe with Quebec, in the Western world that requires its wholesale purchasers of alcohol to buy at retail prices. So I don't know if everyone, the public, knows this, but restaurants buy liquor, wine, and beer at the same price or more that they do in the LCBO. And that's because we pay the retail liquor tax. And then we're expected to resell it at a profit. So we need the government to change that policy, just like BC did recently. They changed their policy. They're giving all of their licensee purchasers a 20% discount. That would change our margins immensely and really give us the breathing room we need if we're doing any sales at all to actually pay our employees and pay our suppliers.
So just so I'm clear, you would like a discount to purchase from the LCBO, or you would like to be able to purchase directly from the manufacturer?
No, so and the way it works in Ontario is when you purchase alcohol, it all goes through the LCBO, not the store, but the LCBO distribution center. So all alcohol in Ontario gets taxed by the provincial government. And if I'm a licensee and I'm buying either retail or on consignment, I pay those taxes. When you purchase as a licensee, you pay a different code of tax than the retail, but the numbers equal the same, or actually sometimes 6% more. So what we're asking is for a discount on licensee purchases. So if I buy alcohol for my restaurant to sell, we need to have prices that reflect that we're a wholesale purchaser of alcohol, and we spend millions and millions of dollars on liquor every year. And why are we still paying the same as someone who goes in and buys a bottle of Canadian Club at the liquor store? It doesn't make any sense. But because of the monopoly of the provincial system, they've been doing this for years, and we've just been living with it. Well, now we can't live with it. We need a proper system that reflects the amount of alcohol we spend, and it reflects the jobs that we provide to good Ontarians on a day-to-day basis. Understood.
Okay, John and Tamara, thank you for that, where the rubber really hits the road view of things. I'd like to introduce another voice to our conversation now who will help us sort of get a bigger picture from 30,000 feet in the air, as we like to say. So we welcome from Don Mills, Ontario, in the capital city's North End, Rafael Gomez, who's a professor with the Centre for Industrial Relations and Human Resources at the University of Toronto. He's the author of a book called Small Business and the City. And Rafael, it's good to welcome you back to TVO, where you've been a guest numerous times. I wonder if we could start with this. No one would be asking any questions if you were asking, what's the significance of the auto industry to Ontario? Or what's the significance of the forestry industry in the north to Ontario? But I'm not sure people know what the significance of the restaurant industry is to the provincial economy. So fill in the blanks. What is it?
Yeah, it's huge. And I think one of the reasons why we don't know is because, the old phrase that came very popular after the global financial crisis, too big to fail. It's unfortunate, but the restaurant sector, because it's made up of largely small independent businesses, it's almost too small to save. That's not true, by the way. We have to save that sector for a variety of reasons, which we'll get into, or we probably mentioned some already. And that's a fundamental problem of the sector. It's a highly competitive sector. In economics, we use the term monopolistic competition, meaning if you're a local restaurant on a corner, you have the monopoly on that corner, and people will go to you. But in a sense, there's a lot of choice that people have as well. Next door, there's probably another restaurant that's serving something else. We enjoy that variety. We benefit from it as a society. And I think that's partly both the strength and the weakness of the sector. In good times, that vibrancy, that dynamism, a restaurant might sadly close, but a new one enters. That dynamic system, without much government support, when you hit a crisis like this, it actually has a huge impact. And, we have tons of people who work in the sector, both as a profession and as a staging ground to gain sometimes valuable work experience. So our younger workers that enter the labor force often find a foothold in the labor market, but also people can have careers in this sector. So it is a vital sector. It has a huge impact, by the way, on our quality of life and our health and well-being. So if you close down that sector, as public health officials have been mentioning, you have a whole set of social determinants of health that actually start to weaken, right? In neighborhoods, you pull out a cornerstone restaurant where people meet and gather, and it's tough going for that neighborhood. So yeah, in part, the reason why the auto industry gets a lot of attention is it's more consolidated, it's more organized. It has large unions, it has a few large employers that can effectively lobby government. And unfortunately, the restaurant sector lags because of its structure.
So is that to say that because of the nature of the way the restaurant business operates in our economy, it is by its nature, yes, more susceptible to pandemic problems, that kind of thing?
I think so, but it doesn't have to be that way. We can always take these moments to reimagine and reconfigure the sector. For example, in countries, we'll just take two that are in continental Europe, Germany and Sweden. They have slightly different models. In Sweden, it's a highly organized society. It's very competitive, very dynamic economy, but it has high levels of unionization that penetrate everywhere, not just in auto, but in sectors like restaurants. Most restaurants have a union and a collective agreement. Now, you say, well, that could harm businesses, right? Not really, because it gets to the point made earlier. Good businesses want to keep their workers attached, and you want to train, and you want to create a whole cycle of promotion and keep the labor and capital relationship going. So in Sweden, they managed to have more voice, political voice, almost as much as larger sectors like auto. And in Germany, they use a slightly different model, whereas they take the whole sector and say, well, we're not going to apply a common labor standard to each sector because each sector is different. So what we'll have is sectoral bargaining. So in the same way that Ontario has employment standards law that seemingly is sort of built for everyone, but then for no one, because everyone wants to claim exemptions because the labor law doesn't fit them. In Germany, what you'd have is the restaurant sector bargaining a set of employment conditions for those workers and that industry. And it doesn't have to just be in labor. It can be with regards to other aspects of public policy, like the one just mentioned regarding alcohol sales. It's clearly unfair, has been for a long time. It wasn't noticed when there were good times and the restaurant sector was booming, but you get hit with one of these shocks, and it's evident that the sector therefore needs a little more organization, a little more structure, and a little more support at the industry level. So you need a strong industry association, and I think you need partners with workers. And I think we have to start looking at different models in which workers can be a little more organized, a little more protected.
Okay, well, let me put that to Tamara. You've heard what Professor Gomez has had to say about that. I mean, to the best of my knowledge, people who get into the restaurant business do so not because they expect to make a fortune, but because, you know, it's in their bones. This is what they do. This is what they love to do. The margins are small, and, you know, you've just heard, you've heard a very different alternative future put forward by Professor Gomez there. How does it strike you?
Personally, I love the idea of the alternative future. At Dispatch, we are a certified living wage employer. We do not operate with the tipped minimum wage model, which is unique in our industry. It's very, very important to us that our team is paid as professionals. They're paid fairly. They're paid equitably. We see a lot of times that, you know, certain groups of hospitality workers can leave at the end of the day with a wad of cash, while their coworkers are struggling to make ends meet. And so the equity piece of that is huge. But just in general, it would be amazing for our industry to be more unified, more united, and have more power, so that as a restaurateur, we can actually charge enough to have a sustainable business that pays our staff fairly, that pays our suppliers fairly, and that feeds the whole production and supply chain. You know, in Niagara, we're surrounded by wineries who are struggling. And, you know, addressing the taxation issues would be huge for that sector as well. So it's all interconnected. And our point of view is that we want to do everything that we can to make not just our business sustainable, but to make the whole industry sustainable. And as it stands now, when restaurateurs try to, you know, charge enough to survive, the public perception is that they're being greedy. They are, you know, not trying to save and provide value. And so having, giving more power to our industry would go a long way with strengthening things, so that if and when we are faced with another disaster such as COVID, we're a little bit stronger to get through.
John, what's your read on that?
Yeah, I couldn't agree more. I think that this crisis has obviously peeled back the layers that expose a lot of the dysfunction in our industry, a lot of ways not only in which the industry is treated, but as Tamara mentioned, as a large sector of our employees have been treated based on the problems in the system in which we work. We need to fix all of that. It's a huge undertaking, and it's even more challenging during a pandemic. You know, we're focused on making sure that we get through this so that we can make these changes. We've begun to make some of these changes in our own company, as Tamara has in hers. It's important that your team and your staff know that you are on their side all the time. And at the same time, if you're not around to do it in the spring, it'll be all for naught. So I think that, you know, we need to make sure as a group we continue to put pressure on the government to change policy that will support us, at the same time showing them that we are a mature, productive, grown-up industry where we treat our teams properly and we are productive members of the economy, and we're not just fly-by-night neighborhood restaurants. Like, just because Tamara and her partner have a 50-seat restaurant in Niagara, it doesn't mean they're not as effective to their local economy in developing GDP and developing a community as a huge restaurant group in Toronto. And I think that that's the challenge with our industry. We have 90,000 CEOs across the country instead of 5. And, creating structure to organize that many individuals is a massive challenge.
Well, Tamara, I wonder if, I'll come back to that expression that Rafael Gomez just used a little while ago. It's not that you're too big to fail, it's that you're too small to save. There are so many of you out there, and it's not like government can just go and sort of purchase a piece of the action as the way they could in GM or Chrysler's case. With 90,000 restaurants out there, the government's not going to go out and buy 90,000 restaurants. But I wonder if you can make the case, somehow coffee shops, a bunch of them, made the case to the public that it's actually worth spending $6 for a cup of coffee because look at the atmosphere, look at the ambiance, look at this, it's become a meeting place. And I wonder if you can make the same case to your customers that it's worth spending more money to come and patronize our restaurant because of the way we treat our people, because of the atmosphere, because of. What do you think?
Absolutely. And, our team does a fantastic job of that already. And our guests are incredibly supportive, and we couldn't be more appreciative of that. But it goes beyond us. There's always, there's the Tim Hortons down the street. There's the cheaper eats models that are very accessible and very available. So that's always going to be kind of a struggle. I always like to say that for some reason, the restaurant industry is treated as every option is kind of comparable. But if you look at any other consumer experience, for example, retail fashion, it's quite clear that, a $6 sweater is different from a ethically sustainable, handmade kind of garment. So it's something that our industry has struggled with for hundreds of years, basically, is conveying that value. So it's something that we've thought about quite a bit. Prior to COVID, we operated largely as a tasting menu experience. And so our customers would pay one fee, come in and have that experience. And it wasn't just a price next to a menu item. Something that we find is when you look at a menu and see that, a steak is $45, as a consumer, you think, well, I could just go to the grocery store and buy a steak and prepare it for much less than that. But the messaging needs to be that restaurants aren't just about a piece of food on a plate. It's about the professionalism. It's about the ambiance, the experience, the music, the decor, the location. All of those things go into a dining experience. And so I think personally, as a communications professional, I think a lot of it comes down to the messaging. And even right now, the messaging that is pretty prevalent that, tipping generously will help the restaurant industry. The reality is that tipping generously does help a segment of the restaurant industry, but it doesn't ensure that those restaurants will be around to employ the servers that you're tipping generously.
Understood.
So the messaging, should be different.
Okay, we're down to our last couple of minutes here. And Rafael, let me get you to gauge, in your view, how useful/helpful you think the government's federal and/or provincial response to helping this sector so far has been.
Well, it's like I said, I think the sector has missed a lot of attention from government. And I think they've been sort of sidelined. And I think it's sad because as we learned more about this virus and the pandemic and how it spreads, actually the restaurant sector could be a vital role in returning us to some version of normalcy, and actually could have a very powerful and positive health benefit. And we talk about social determinants of health. That's an area that public health professionals talk about, less so the medical profession, which kind of looks at the intricacies of the virus and what it does to us. And I think the preponderance of public policy attention has been veered towards the medical model, protecting our hospitals. But look what happened in that kind of version of sort of staving off the virus. We left unprotected, say, our care homes. In the same way, we need a more public health lens that looks at the totality of what brings us health and well-being. restaurants play a vital role. Our main streets and the businesses that inhabit it there are reasons why we have healthier cities and healthier populations. If you do it in a structured way, knowing how the virus can spread amongst people, and your staff are checked, this is a way in which we can preserve the public space and socialization, which is critical to maintaining our health as a society. So I think the restaurant sector, if it had this more organized, pre-pandemic, more organized voice that had a voice for labor, had a voice for the restaurant owners, it could have kind of made the case and perhaps aligned itself with those other voices. It's still not too late. I think we are learning more and more that actually structured environments are actually better places for us to spend our time. It's a safer place. And I think that's where we need to pivot, to use the word of the COVID 2020 epidemic. If we could pivot that way, this would actually help the restaurant sector. It would bring to light the importance of the sector in terms of its employment. It regenerates so much money locally, because who does the local restaurant employ to do their accounting? A local accountant. And who would do their legal service? A local legal professional. It's a really resilient sector for local economies. And just one last piece, Van City from out in Vancouver, which is a credit union, a local credit union that invests in local communities. They did a study across Canada of several neighborhoods. And what they found is the neighborhoods that have been most resilient, so we talk about sustainability, but a resilient neighborhood, have been ones that focused on their local populations. In other words, the restaurants didn't even have to move to a real fancy online model. They could take orders over the phone. People did those pickups. Those neighborhoods, which often weren't the most affluent, actually survived better than areas that were dependent on, we'll say, tourism, right? And that was a fragile sector. And when you stopped cross-border travel, a lot of those restaurants on those areas of different cities really suffered. But the ones that were tied to their local community actually didn't do too bad. So maybe a long-winded answer, but I think it's a positive one if we can get the sector's voice heard a little more loudly.
Understood. Tamara Jensen, John Sinopoli, Rafael Gomez, of all of you to spend some time with us on TVO tonight, and in particular to John and Tamara, good luck out there, okay?
Thank you, Steve.
Thank you.
And that is the agenda for Monday, September 21st, 2020. As the Canadian Emergency Relief Benefit, the CERB, winds down this month, some want a new universal basic income to replace it. Tomorrow we'll ask what such a policy choice would look like and how it might relate to the future of work. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
The Agenda is always on. To catch up on conversations from this week or any week, visit our website, tvo.org/theagenda, or our YouTube page at youtube.com/theagenda. It's all there for whenever you want to watch.